Rasayana in perspective of the present scenario. This is printed in the National Library of Medicine, April to June 2018. In spite of advancement in medical science with the invention of sophisticated investigative tools and deep knowledge of human physiology and its structure, there had been no significant control over diseases. Rather, new health issues are emerging, and in many cases with no remedial solution. These disorders are either metabolic, genetic, or infectious in origin. Being a part of healthcare delivery system, the time has come to reanalyze the system of health management and look back at the philosophy of prevention and preservation as the first step to the treatment. Every system of medicine emphasizes on treating the disease, but in Ayurveda, treating a disease is always secondary, rather, maintaining and preserving health, which is the first objective of healthcare plans. Maybe for this reason, utmost importance has been given for maintenance and sustenance of health in Ayurveda, considering physical, mental, and sexual aspects. To achieve this goal, daily regimens and seasonal regimen, code of conduct of diet, and social behavior are mentioned in Ayurveda, along with implications of Rasayana. Rasayana is one of the comprehensive disciplines of Ayurveda, which comprises a specialized use of herbs, herbo-mineral formulations, food articles, and lifestyle, along with self-discipline with social etiquette to achieve the optimum state of tissues and systems of the body, so that there is at least the least effect of etiological factors on the body. In other words, it can be stated that Rasayana is a way to achieve homeostasis, and thus retarding the process of aging phenomenon and prevention of diseases. In healthy condition, Rasayana can be understood as nutritional dynamics for rejuvenation of body and psyche. Aging in Ayurveda is considered as disease occurring due to the natural process of degeneration, and thus preventing premature aging and making aging in a healthy way also considered under the aspect of Rasayana. Looking at the multifaceted approach of Rasayana, it can be said that a deep analysis of health parameters, its assessment, and its maintenance was the first approach of Ayurveda, and thus treatment in Ayurveda is defined in all such activities in the form of diet, lifestyle, or medicines, which target at Dhatu Samya, achieving of the state of homeostasis and not merely treating the disease. Preservation of health and occurring of disease, as per Ayurveda, depends basically on how persons maintains their quality and quantity of food, along with food habits, lifestyle, psychological status, and effect of environmental conditions. Thus, quality and quantity of food plays major role in the health preservation, with due consideration of the status of Agni, the digestion and metabolism mechanics, and the suitability of individual depending on his prakriti, the body constitution. Considering this fact, healthy food habits and nutritious foods have been considered as Ajrika Rasayana, Rasayana in the form of food, which includes nourishing, suitable, healthy foods. Thus, awareness among the society about role of healthy food and food habits has to be reintroduced, keeping in mind the present lifestyle of the people. As per Ayurveda, milk, ghee, clarified butter, honey are a few examples of such Ajrika Rasayana, and can be practiced in judicious manner in healthy individuals. Further, as per Ayurveda, with advancing of age, there are certain organ and system-related changes, and replenishing of these structures may postpone many age-related health issues, and thus Rasayana, that is age-specific, can be prescribed for particular age groups, which can ultimately retard age-specific conditions to some extent and can promote longevity. Thus, a plan for Rasayana therapy right from birth shall be introduced in routine immunization schedule. In today's era, human life has been affected by drastic changes in atmosphere, diet, and lifestyle. And thus the biggest challenge for humanity is to survive in this changed environment and compete with the pace of life. Further, newly emerging infections and metabolic disorders have posed challenges to healthcare systems. To meet this challenge, awareness among mass regarding prevented use of Rasayana as prophylactic can be introduced. Some Rasayanas are also disease-specific and are used in specific disease states, as they induce specific immunity and biostrength to combat a particular disease. Such Rasayana is called as Namtika Rasayana. The tissue-specific Rasayana drugs can be administered along with the treatment of the underlying disease to enhance the tissue strength and disease-combating power so that faster and better relief may be provided and recurrences may be prevented. Like a person in pre-diabetes state can be given simple herbs like guduchi, amlaka, and thus can prevent diabetes. There can be many other Namtika Rasayanas which may be identified as an appropriate trial, and few researchers in the past have proved their immunomodulating actions. Clinical trials at IPGT and RA Jamnagar have shown that the use of appropriate Rasayana drugs such as ashwagandha, guduchi, and pipala to the treatment of allergic disorders such as eczema, urticaria, allergic rhinitis, and bronchial asthma helps for better and faster relief and prevents recurrences. Similarly, to combat autoimmune disorders such as rheumatoid arthritis or cancer or pulmonary tuberculosis. Advocating Rasayana drug as adjuvant to ongoing medicines can also provide encouraging result and improve the quality of life of patients. Furthermore, in stress-induced conditions such as anxiety and insomnia, or neurodegenerative conditions such as Parkinson's disease, Alzheimer's disease, and senile dementia, administration of Medya Rasayana nootropics provides marked improvement in the quality of life of patients. The findings of all these studies indicate that Rasayana has a definite role to play in the maintenance and preservation of health, and the appropriate use of Rasayana can help to bring down the prevalence of many diseases, ultimately reducing healthcare burden. Time has come when more focus shall be done on preventative aspects of diseases, and thus the present policy of healthcare system shall deal with an awareness among the mass about Rasayana utility. Quality of life is important for an individual, and thus researchers in Ayurveda shall also focus on identifying key areas of application of Rasayana, and sufficient evidence shall be generated with guidelines so the Rasayana therapy can be included in the national health policy, and Ayurveda can contribute for the betterment of humanity.